Okay, let's go ahead and pick up where we left off. So let's try to get relatively close to the end of the chapter. So let's go ahead and kind of pick up with our thoracic muscles. So when you take a look at your thoracic muscles, pretty much they're dominated by your respiratory system. First of all, starting off with your scalenes, which are essentially there to elevate your ribs, especially the upper portion from your clavicle on up, to basically lift it up. Your external intercostals will also elevate your ribs and kind of expand laterally. And then your internal intercostals and a muscle called the transversus thoracis. This is basically there to depress the ribs during expiration. And then, of course, the diaphragm is the biggie. That's the grand poobah, right? This is the one that's responsible for actually expanding your lungs out and actually bringing in the air. So this is kind of like the quick rundown, your diaphragm. So these are all basically muscles associated with respiration, of course, dominated by the biggie, which is your big bell-shaped diaphragm, which is resting right underneath your lungs and basically is the boundary between your thoracic cavity and your abdominal cavity. Then, of course, your external intercostals, you have a couple of pairs of intercostal muscles. So your internal intercostals are the innermost piece right up next to the sternum, and your external intercostals are on the outer lateral edge. And then we saw the scalenes before. These are isolated, so you can see how they're basically attached to the cervical vertebrae, the transverse processes of the cervical vertebrae, and they're attached to the upper two ribs to basically pull up your rib cage so that it can basically expand out while you're breathing and make room for your inflating lungs. Otherwise, breathing in would probably feel an awful lot like somebody's like constricting on you, like a boa constrictor sort of cinching down on you. So it'd be pretty uncomfortable to breathe in if that weren't the case. So the abdominal muscles, so the muscles of the abdominal wall, when you're breathing, can also, because these two cavities, thoracic and abdominal, are kind of connected. I mean, obviously the diaphragm is sort of the dividing line, but it's not like an airtight dividing line, right? So basically you have communication between the two of them. So when your abdominal wall flexes, you can decrease the volume of the abdominal cavity and the thoracic cavities together at the same time. And so when you're doing this, what this does for you, when you're kind of clenching down on all of your thoracic cavity, your abdominal muscles, and your thoracic muscles, then this aids in what we refer to as forced exhalation or other kind of violent convulsive types of actions that your body runs into, things like vomiting, defecation, urination, things like that. So you can basically utilize the entirety of your thoracic, both abdominal and the upper muscles, in kind of a coordinated effort to essentially give you overall upper body power. And so the fact that you have the muscle fibers of your abdominal cavity sort of laid down in different directions gives you basically tension in multiple directions. For instance, the rectus abdominis, which is the main one that you see, which kind of forms your six pack. This is the one that you see kind of going down the front side. And then you have your obliques, internal and externals, which are basically in kind of more of a diagonal, sort of like a girdle wrapped around your waist. And then the external is a larger sheet that's wrapped over top of the internal obliques and the rectus abdominis. And so basically, you have kind of like a wrapping. It's almost kind of like multiple wraps, almost like a waist belt, kind of wrapped around your midsection. And what this does together, all of these, and you don't want to forget the transversus abdominis, right? The transversus abdominis is the deepest layer, basically kind of going laterally and kind of in sort of cross section across the body. And so you can see you have multiple angles of these muscle fibers going in multiple directions and in multiple axes, and it's kind of wrapped around your waist like a waist belt, giving you maximum core strength when you're talking about your strength. So here's a well-developed individual. So you can see the parts, or the bellies, if you will, of the rectus abdominis. So basically that's your six-pack. That's basically what you're looking at, is your rectus abdominis. On the side, you're going to see your external obliques. If you were to cut that and reflect it, then you would see your internals and your transverse abdominis. So when you kind of take a look at the cutaway, you can see that on the outside, your external obliques are kind of wrapping everything, and you've got this large sort of tendinous, this rectus sheath, which kind of covers everything. And this is kind of like a gigantic bell-like piece of connective tissue sheet that covers up the rectus abdominis, which is underneath. And then, of course, the internal obliques, which are underneath, and the transverse. So here you can see they kind of basically cut and reflected them in series. So the superficial most is your external abdominal obliques, basically. They kind of cut those, peel those away. Underneath, you can see the internal obliques. And then when they cut that away, got like a little window in here, you can see a combination of the edge of the rectus abdominis, and then underneath that, you can see the transverse abdominis, or transverse abdominis. So basically, these are your muscles of your abdomen that go along with the muscles that are overlaying the upper portion that are on top of the thoracic cavity. Okay, now what about the pelvic cavity, right? So basically the pelvic floor, which is kind of a bottom or a floor-like structure of the pelvic cavity. So the pelvic cavity is the lowest chamber. Oftentimes it is kind of abdominopelvic. You kind of lump the two together because it's one gigantic space. And then you have the floor of the pelvic cavity, and then the musculature associated with it. So it's kind of like a large sort of funnel-shaped type of viscera. It's basically sheets of tissue, and then ultimately in these sheets, you basically kind of puncture, or you poke through the different structures you need to get through it. So for instance, the anal canal needs to get through there so you can get to the outside world. Your urethra has to get out there. The vagina has to get out there. And so this is basically what's kind of on the pelvic floor as you're kind of getting to that point where you get the junction between the inside and the outside of the body. And the urogenital triangle is basically the area where you see the kind of lower portion of the perineum, which is kind of this diamond-shaped area. And so ultimately it's kind of below and anterior. So you can sort of see some of that here in these particular images. So they're not the greatest, but I mean, you can kind of see what it looks like. So what you're seeing here is they got some cutaways here, so you can kind of see down in there. So just to kind of orient ourselves, first of all, what we've done is we sort of cut away sort of the bottom side. And this is basically the anus right here in the middle. And then you can see the cutaway of the gluteus maximus. So that's the larger portion of your buttocks muscle. That's the big one that you sit on. And then wrapped around the anus, you're going to see your anal sphincters. You got two sets of sphincters. You got internal and external anal sphincters. And so this is the external anal sphincter. And then as you kind of sort of start to take a close look at, I don't want to go through all of them. There's a couple of broad brush strokes that I just want to sort of point out, just so you kind of get an idea of the lay of the land, because this isn't going to be one of those big hills to die on when it comes to the exam piece. But you can see how basically you kind of have this giant sheet of kind of connective tissue and musculature, which kind of forms this sort of bottom floor made of multiple muscles. It's not like the thoracic, where you just have this bell-like shaped diaphragm, which is a single muscle that kind of forms the bottom. You have actually quite a few muscles here. that are kind of making a lot of this up. And so you can see there's a lot of muscles. A couple of things I want to point out. First of all, is notice the attachment of the sphincter muscles to the coccyx, right? So a lot of times people, think, oh, the coccyx doesn't do anything. The coccygeus also is connected to the coccyx as well. So if you damage or break your coccyx, good luck trying to defecate, because it's going to hurt, and it's going to hurt bad. And so that's kind of one of the things that I kind of wanted to point out. But you can also see that there's a lot of musculature in this area, more so than most people think. And you can see it's kind of a similar story for females. You can see the urogenital triangle, which is that big triangular shaped area. And then in this particular case, you've got the anus, and then just above that is the vagina, where above that in the males is going to be essentially the inside portion of where the reproductive organs are leading out into the external area of the body. So basically, kind of the floor of the testes and the structure that basically supports the testes that the testes basically grow out of. And so that's just kind of like an idea with the pelvic floor. You don't have to worry about this too much, because I don't want us to die on this hill too badly. There's other bigger fish to fry. Just wanted to sort of cover that, just so you get an idea of kind of a little bit about what the musculature looks like down there on the pelvic floor. So the upper limb muscles. So the upper limb muscles, oftentimes when you're taking a look at this, basically you're looking at scapular movements of the scapula, and they're stabilizing the scapula and the clavicle. And so this gives you a wide range of movements. So they originate typically in the axial skeleton. And so a lot of these that you see are kind of like in that upper neck region. So for instance, we're looking at things like the trapezius, the levator scapula, the rhomboideus, the serratus anterior, the pectoralis minor. A lot of you guys were looking at this the other day, and you noticed that a lot of them were basically originating on either the transverse processes of the cervical or on the spinous processes of the vertebra, either cervical or thoracic, depending on where you are. And so that's true for a lot of these, right? Because they're basically stabilizing that scapula and kind of connecting it together as a continuous unit along with the head and the shoulder. So you're kind of connecting your neck, shoulders, and your scapula together. And that gives you a lot of upper sort of shoulder and pectoral girdle range of motion. So then the shoulder muscle. So this is kind of like that sort of the scapular muscles, the ones that you see kind of in your upper back region. Now, the shoulder muscles, you basically have are essentially associated with different types of motions and muscle actions on the shoulder and arm. And this is kind of a nice little chart down here, 1014, because what it does is it basically takes some of the muscles you guys have been learning, and it kind of lumps them together with their action. For instance, some of the flexions, some of the flexors you're going to see are things like the deltoid, the pectoralis major, the biceps brachii. The extension is also the deltoid, teres major, latissimus dorsi. So they basically kind of lump them together, associated with the kinds of motions that they actually do. And this is kind of helpful a lot of times, because it kind of helps you to sort of organize these and sort of put them together, and kind of helps them to sort of make a little bit more sense. So it's kind of what it looks like, what we're looking at here. So you can see the rhomboideus major. So you can see how it's basically originated on the spinous process of the thoracic vertebra. And then the rhomboideus minor, which is the smaller rhomboid, which is going to be up here on the 7th cervical, so C6 and 7. That's basically where it's originating. And then the levator scapula, which typically is going to be attached to the superior angle of the scapula, and it's going to be basically coming off of that and then heading underneath. You'll be able to see that kind of going underneath and attaching to the base of the skull. And then, of course, the trapezius, which is that large triangular sheet that kind of covers the top of it. And so together, all of these work together to basically stabilize the scapula and be able to move that upper portion of your body. Now, serratus anterior is kind of like this sort of like serrated, looks like little feathers basically underneath your arm. If you lift your arm up, you'll see this like little feathery looking structure. And this is basically attached to your rib cage and to your vertebra. So this is associated with the movements of your upper rib cage. Because remember, your rib cage isn't just moving for the purpose of breathing, it's also moving and flexing when you're doing all these upper body and upper pectoral girdle motions as well, right? So that the whole system kind of has to move together in sort of a coordinated fashion. Okay. And so this is kind of like the surface view of a lot of those, where you have your deltoid overlaying on top. On the top part of your arm, you can see how it's originating to the clavicle and then attaching down to the brachial area, and that's overlying your pectoralis major and your minors, which is underneath. And you can see this little feather-like serratus anterior underneath all of that. So you can see you basically have kind of a strategy here where you're basically kind of attaching a lot of these muscles to first of all be able to move the upper portion of your chest region, especially your rib cage. And if you think about it, we are like incredibly mobile when it comes to our chest region. And that's because of a lot of these different muscles, which are attached to different areas, allowing us a little bit of extra flexibility and motion. We don't really think about it all that much because any one muscle doesn't give us a lot of range of motion. But what we are masters at is basically taking a lot of little muscles with a little bit of range of motion and add them together. And so all of them working together gives us an additive kind of a summit of range of motion, which gives us a lot of flexibility in our torso area. So for the arm movements, right? So just when you're moving your arm itself, so some of the stability piece of it, obviously because your arm is attached to your torso, you kind of have to stabilize your arm, because we usually think about our arm motions as sort of like more like terminal structures. But your pectoralis major and your latissimus dorsi are important muscles when it comes to sort of stabilizing the arm motions and attaching it to your body. So for instance, the pectoralis major is what I call the bench press muscle, right? So that's basically allowing your arm to kind of move and extend out in front of you, oftentimes holding a weight, and that's how you build up your chest muscles. The latissimus dorsi is what I call the swim muscle. So the bringing your arm over in a rotational motion and kind of pulling water away from you, like when you're doing just your freestyle swim, that basically is swim motion. That's a lot of latissimus dorsi. So you can see those lats basically flaring on the side. So ultimately, you can see the latissimus dorsi here, that swim motion, which is allowing you to do that rotational swimming motion itself. And then, of course, the pectoralis major, which is this guy, which is attached to the arm and is allowing you to basically move your arm in front of you. And also, since it's a fairly good sized muscle, you're able to actually accommodate a fairly decent sized load on that as well. Okay, where did I leave off? Okay, let's just now deltoid, right? Basically, both of these guys together with pectoralis major is working as a flexor and an extensor of the shoulder, right? So the flexor piece, that's the bench press area, and then the deltoid, the flexor, the extensor part is kind of the deltoid. So they're kind of working together a little bit, not quite as clean as say triceps versus like biceps. So that's a really, really clean sort of antagonistic relationship between those two. But they do enough to be able to kind of extend and flex. And so the deltoid basically is going to abduct. So remember, abduct means to move away from the midline. And it's going to do that medially, so it can abduct medially and also laterally, which rotates the arm. So so it's basically helping in all that medial and lateral rotation. So basically, when you're kind of flapping your arms up and down, so you come medially or laterally, that's basically kind of a rotational thing. Now, the rotator cuff, basically, this is a group of 4 muscles, and their job is basically to hold your arm into your shoulder. So literally the rotator cuff is what's holding your arm on your body, and it's holding the humerus, the head of the humerus, in the glenoid cavity, which is that little shallow portion of that ball and socket joint. And so this is kind of what it looks like. So here you can see you have a couple of muscles. Let's start off with the model first, right? So you have your rotator cuff group. So the first part of the rotator cuff is going to be the supraspinatus, which is the muscle that sits on top of the scapular spine. And then the second member of the rotator cuff group is going to be infraspinatus. This is that big one that you guys saw when you kind of opened up the cats and you saw that big muscle sitting right just on the other side of the angle of the edge, the medial edge of the scapula. Then underneath that, you're going to notice there's what's called the teres minor. And the teres minor is the 4th member of the rotator cuff group. And then beneath the scapula, which you can't see here, is subscapularis. So this is going to be underneath the scapula. So those 4 together represent what we refer to as the rotator cuff. This is essentially what's holding your humerus onto your body. And so you can see how they're either originating on the scapula, so which is true for supraspinatus, infraspinatus, and subscapularis, or in this case, they are tethered, the other side is tethered to the head of the humerus. So you can see how the other connection is tethered to the head of the humerus, holding the head of the humerus into the glenoid cavity. And then here you can see your big latissimus dorsi, which is attached to your arm. And so when you contract that, it basically gives you a nice, strong, powerful, rotational type of movement. So when you basically take a look at the cadaver, you can see some of these elements pretty nicely. So you can see that triangular shaped deltoid right here. This guy right here, because you've kind of pulled the trapezius away a little bit. Here's the leading edge of the trapezius going down like that. So you can see a little bit of the infraspinatus underneath here. This is teres minor right here. And this is teres major right here. And so you can see very clear latissimus dorsi. And you can see some of that actually on the body of somebody who has well-built muscles. So you can see the infraspinatus is kind of bulging out here. Sometimes you can see the teres minor, the teres major, and then you can see the large latissimus dorsi underneath. So peel away all the rest of the muscles and sort of isolate the rotator cuff so you can get a good look at it. What you end up seeing here kind of edge on are kind of the major pieces. So you can see how all 4 muscles are attached to the humerus, to the head of the humerus. So you can see subscapularis wraps around and attaches to the lesser tubercle of the humerus. And then to the greater tubercle, you have both the tendon for the supraspinatus, for infraspinatus here, and also for the other side of teres minor. So teres minor is basically connected here. And so you can see that that's the reason why when we studied skeleton, we had to know lesser tubercle, greater tubercle, because this is where some important muscles are actually attached. And all 4 of them together basically holds your head of the humerus into your glenoid cavity, which you can see right here in this little blue strip right there. That's the strip of the glenoid cavity. That represents the socket part of your ball and socket joint. So muscles of the arm that are acting on the arm. So this is basically kind of a rundown of the muscles we just talked about. So teres major probably is the only one that we didn't really talk about very much. So this one is kind of on the lateral border, so or originates on the lateral border of the scapula, and then its job is to basically extend the shoulder and adduct the arm itself. So it's also involved in the arm, but it doesn't hold the humerus on there. The rotator cuff group is responsible for holding the humerus in place. So all these, notice, have the same phrase: holds the head of the humerus in place, holds the head of the humerus in place, holds the head of the humerus in place, and then holds the head of the humerus in place. All four of these are necessary. So when you're a pitcher, oftentimes a pitcher, they do it a lot. If you get a rotator cuff injury, that basically means you've probably torn one of those tendons, or you've done some damage to that connection. And so oftentimes you kind of have to sort of back away and perhaps maybe surgically repair that. And so that's what a rotator cuff injury is. It's an injury to one of those four connections holding your humerus onto your glenoid cavity. Now, the forearm movements basically can be broken into a couple of major groups, right? So essentially you have the extension flexion. So for instance, the extensors of the upper arm, triceps brachii and anconeus, are extensors. And for the flexors on the upper arm, you basically have your biceps brachii, brachioradialis, and your brachialis. So these are your flexors of the arm. And so this is typically, for the most part, upper arm movements that we're talking about here. In addition to that, you also have supination and pronation. So these guys are actually a pretty important group. And so for supination of the arm, you have the supinator, and then for pronation, you have pronator quadratus and pronator teres. And so we noticed some of these actually in our models as well, especially pronator teres we found, which is a pronator of the forearm. And so you can see the upper arm piece here, the basic anatomy of the upper arm, where you have your deltoid. You got to cut that deltoid away to get a good look at what's underneath. You can see the triceps basically with the long head and the lateral head, and then you can see the biceps brachii, which is this guy right here, and then the brachialis, which is typically right here. This is the lateral view. This is like if I'm looking at the side of you. So the brachialis is a small little muscle. It represents that little kind of soft spot, that little dip in your arm. That's where your brachialis is. And then your brachioradialis is kind of wrapping sort of around your elbow joint and kind of attaches and goes over your forearm, the top part of your forearm. So as you cut that away, you can see a better look at your biceps, which are these two guys here. So you can see the two bellies of the biceps here. You can see how each of them is basically attached to the coracoid process. And so it's tethered to your shoulder, to your scapula. That's its origin. And its insertion is basically going to be attached to the lower arm. So you can kind of see how these things are attached. And of course, these are the cadaver shots. And then the real person shot. So the brachialis oftentimes is kind of like an area where you see right here in the middle of the arm. That's the brachialis. That big bulge in the back of the arm is going to be the triceps. And then, of course, the biceps are the guns, right? So that's the upper arm. So this is a pretty important piece because it overlaps and sort of dovetails with our lab stuff as well. Now, to a lesser extent, we have sort of the wrist and hand movements. So for instance, we have flexion of the hands, of course, adduction, abduction of the wrist, and of course, extension and abduction as well. And so typically when you take a look at this, you have a type of tendinous fascia called the retinaculum, which is kind of like a wristband, if you will, of connective tissue. And that basically will kind of wrap up your carpal ligaments in your wrist and kind of create like a little bit of a wristband. And so you can see, let's see if they show the retinaculum here. They don't really show a good view of it, but it's kind of like basically a little connective tissue band that sort of wraps around all of your ligaments that are going into the wrist area. And so this is basically a nice little um, table. This is one that I would suggest that you put a star next to and that you study, especially for the models, because this pretty much has all of the muscles in it that we want to know, right? So brachioradialis, it's got its origin and it's got its insertion, so the styloid process of the radius. It's got also flexor carpi radialis, which is one of those arm muscles that is on our list to know. So it flexes and adducts the wrist, carpals, right? The wrist. Flexor carpi ulnaris. This is going to be an ulnar flexor of the wrist. The flexor digitorum profundus, which is one that we didn't see in our models, but still, it's an important flexor. And this is basically getting to your phalanges. So basically moving your fingers around. Flexor digitorum superficialis is another one that's kind of a little bit deeper. These are deeper muscles. This is also a phalangeal flexor. If you see the term pollicis, that's a thumb thing, right? So this is a flexor of the thumb, flexor pollicis longus. That's going to be a thumb flexor. Palmaris longus, we saw this one. This one is on our list, right? So this is one that basically flexes the wrist and has basically the palmar fascia. So you can actually see this is basically where the palmaris longus kind of allows you to flex your fingers. Pronator quadratus, this is another one that's a little on the deep side, but this is a pronator of the forearm. Pronator teres is also a forearm pronator. So it turns your wrist face down. And then, of course, the supinator, which is one that we often have run into supinator. So this is the antagonist pronator teres, or the forearm, as opposed to the pronator, the forearm. Okay, so here's kind of like a really good view. I'd probably put these guys on your hot list of things to just kind of add in there to kind of study. So here you can see on your ulna side. So you have your ulnar side over here. Remember the radius is the thumb. That's the radial side. So over here you have your flexor carpi ulnaris. You can actually see that it's originating in the ulna, on the ulnar side of the wrist. That is the carpals. As you start to move inward, you're going to have your flexor carpi radialis. You can actually see how it's basically terminating in the radial side of the wrist. So you know it's a carpi radialis, and it's a flexor because it's on the flexor side. And then your pronator, typically the way you know pronators versus supinators is that they're oftentimes diagonal. So how do you know that this is a pronator? Because it's a diagonal muscle instead of a straight muscle. So when it shortens, it's going to rotate the arm, basically rolling it over. And a supinator is also similar in the sense that it'll rotate the arm in the opposite direction. So as you start to take a look then at the anterior view, we're kind of putting the deeper side of things in here. So you can see your brachioradialis, which is basically attached to your brachium up here, and then to your radius, that styloid process radius. So underneath all of these flexors, if you kind of peel them away, you'll see this guy right here, which is your flexor digitorum superficialis. So you can see where the tendons of this guy goes. It basically goes to your digits. So you can see it's flexing the digits. You can see the name tells you what it is. It's a flexor of the digits, of the superficial digits. It's not a superficial muscle, but it's a deep muscle. So it's a little misleading on that one. And then and deeper to that, then you'll see your flexor digitorum profundus, which is basically this kind of trio of tendons that basically attaches to the three lesser fingers. And then this one right here will attach to the index finger. This is one of the reasons why your index finger has so much flexibility and mobility is because it's got its own muscle body. The body of one of the muscles is dedicated to that finger, whereas the other three are kind of interconnected. And so they don't have quite as much freedom and liberty. So the pollicis longus is basically going to be connected to the thumb. So you can actually see where these are located by where their connections are. So this is another one. I'd spent a little bit of time here. However, don't prioritize ones that we haven't covered extensively. For instance, obviously the adductor pollicis longus, we didn't cover a whole lot in lab. Anconius, we did. Extensor carpi radialis brevis and longus, we did, but we covered it as a group, as a duo. The extensor carpi ulnaris, we did. The extensor digiti minimi, extensor digitorum. And these are other types of extensors. The index finger, the forefinger, and the thumb. So we have extensor pollicis brevis and longus, but we didn't really cover those so much. And so these are guys that I'd probably take a look at and kind of get to know. Now, when you're taking a look at your extensor group, as you're starting to sort of roll it around, you can see we always start with our landmark, right? Or start with our brachioradialis. Then as you start to roll this direction, you're going to run into your extensor carpi radialis longus, right? And you also have brevis. So this is the long body of the muscle. And then you have a shorter body of the muscle. So that's longus and brevis. And then you have your extensor digitorum. And then typically kind of smacked in between there and underneath, you'll see extensor digiti minimi. And so that one, we may have an image here. I think we have to sort of remove a few muscles to get a look at that one. But we can see that one really easily on our models because we can sort of see it laying underneath these individuals. And then as we start to move to the ulnar side, notice we start to get to extensor carpi ulnaris. And then notice carpi ulnaris, the extensor carpi ulnaris is right next to the flexor carpi ulnaris. So this is a flexor because you're rotating and you're switching over from the extensors to the flexors. And then up here you can see your anconius. So here's your anconius up here. This is, again, a supinator. And that's because it's diagonal. Just like your pronator teres is a diagonal pronator, this one is a diagonal supinator. So you can tell supinator and a pronator by the orientation of what they look like. And down here you can see we have our extensor retinaculum, this sort of like wristband of connective tissue that bundles up all of these tendons at your wrist point. So this is just a slightly deeper view of the muscles, but this basically harbors some of the muscles that aren't really high on our priority list. So this is what it looks like under cadaver shot. I don't want to spend a whole lot of time on this one because I don't want to add unnecessary detail there, but versus a real individual. The hand muscles are, for the most part, fairly straightforward. You basically have just a couple of different types of muscles. Essentially muscles that are in between the phalanges, that are in between the tendons, which are called lumbricals. And they basically are attached to the actual fingers themselves. And you have a various types of, most of your musculature obviously is attached to your thumb. So you have all these different pollicis muscles, right? So your adductor pollicis brevis, opponens pollicis, flexor pollicis. So notice all of these are thumb movers. Why? Because the opposable thumb is one of our innovations. And so we have a lot of musculature associated with our thumb movements. And then on the other side of our palm, then we have a lot of sort of minimal digit movers, right? So we have adductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. So these are all minimal digit, that is pinky, movers. And so you have two different things going on in opposite sides of the hand, which gives you a combination of opposition. Or opposition is the ability to connect your pinky to your thumb. So those two together gives you a lot of range and grip Allows you to wrap your hand around things. Okay, let's go ahead and take a look at lower limb. So lower limb, basically a lot of your thigh muscles are originating on the coxal bone, and they insert onto the femur. So they're pulling on your tailbone. They insert on the femur. So for instance, on the anterior, you're going to have the iliacus and the psoas major. Basically together, they are the iliopsoas, and they basically share a tendon of the same insertion. Posterior lateral gluteals and tensor fasciae lata. A lot of you guys were talking about tensor fasciae lata. This is basically extension of the thigh itself. That's what those guys do. And then if you go deep, you're going to be getting into your gluteus maximus and your thigh rotators. And so that's basically what we have here. So your iliopsoas, this is a really important one because this kind of forms the power base of your body, right? So your hip girdle and the power of your hip area. So basically your iliopsoas is going to be associated with flexion, whereas your gluteus maximus is going to be the extension and abduction, and your adductor magnus, which is your kind of groin area, is going to be adduction. So remember, that's moving toward your midline. And then your tensor fasciae lata is going to be medial rotation. So rotating your leg to the inside is going to be tensor fasciae lata. And of course, gluteus maximus, you notice, is in a lot of these motions. That's going to be lateral rotation. So your butt muscle basically is going to be involved in a lot of that sort of lower trunk power. And that's what a lot of these guys are, because if you notice, a lot of these are working on medial rotation, lateral rotation, and basically power moves. They're not going to be very fine moves, but they're going to be designed for power, right? And that's kind of where you have essentially your truck. So let's go and take a look at sort of a view of your hip area. So first of all, you're going to have your gluteal groups, right? So the gluteus maximus, which is the bulk of your buttocks muscle. So you can see how it's basically attached to the sacrum and then to the upper portion of the femur. And then the gluteus medius, which is going to be connected to the iliac crest. And it's going to be stabilizing. And the gluteus minimus is going to be attached to the upper portion of your femur, the greater trochanter of your femur, and it's going to be stabilizing and holding your femur into that ball and socket joint. So kind of holding it all together while your gluteus maximus is giving you a big muscular power in the upper portion of your pelvic girdle. So you can see how you have a lot of power here in this particular case. And so your iliotibials actually keep them side on. You can see you've got your gluteus maximus, which is basically what you sit on. Your gluteus medius is kind of up here more by your iliac crest, which is kind of like the external piece of the side, the lateral part of your girdle. And the tensor fasciae lata is basically kind of, if you roll forward, you're going to pass the connective tissue sheet, and you're going to feel a little bit of a soft spot. That's your muscle before you kind of dip into kind of the bowl portion of your pelvic cavity, where you see the crest kind of dip down. So you're going to feel a little bit of muscle right there, and that's going to be the tensor fasciae lata, which basically terminates into this long tendinous sheet, which is your iliotibial tract, and that connects to your kneecap. So that's your sergeant stripe. And then when you take a look at some of the cutaways, and the one I want to really show you here is these kind of deep adductors here. So you can see how your psoas major is connected to your lumbar vertebrae. And then down here, it's going to be connected to your femur. That stabilizes your pelvic girdle tremendously. And then your iliacus is going to be attached to the inside portion of your iliac crest, and then also to your femur. So you can see how basically you got some pretty powerful muscles that are connecting both your lower lumbar and your pelvic girdle to your femur. So this is some pretty powerful stuff here. And then your pectineus, which is going to be attaching the lower portion of your pelvic girdle to your femur. And then also to that is going to be your adductors, right? So we saw a lot of these. For instance, we saw adductor longus, which is kind of a long adductor that attaches to the lower portion of your pelvic girdle and then to the side of your femur. And then your adductor magnus, which is a large fan-shaped adductor that's attaching to the medial condyle of your femur and kind of fanning all the way up to the upper portion of your femur. So it's a really, really big adductor. And then overlaying on top of that is a thin strip of gracilis, which kind of wraps its way over and attaches to the side of the tibia. And so this is a really, really powerful piece. So what's in your muscle, this is before we get to the quad group, right? So what's under in this groin area are some pretty powerful adductors that are attached to the lower portions of your pelvic girdle and also that are connected to the upper portions or the lower portions of your lumbar that kind of go through the pelvic girdle. So your pelvic girdle is really, really powerfully tied to your femur. So it's not easy to rip a leg off your body. So this one, I'm going to give it a star because this is really important. It's going to be forming a lot of that powerful base of your body. And these are the adductors, right? So that inner adductor thigh group. So these are a pretty big deal. So then when you're taking a look at your basic leg movements, you're looking at extension of the leg. So the rectus femoris also will be a flexor of the hip as well. So when you're kind of picking your leg up, that's a flexion of the hip. And so the tendon will wrap over the patella and merge with the patellar tendon. And then it will attach to the tibial tuberosity. So it kind of wraps over your knee. And then your sartorius, which is there for lateral rotation of the thigh, and it also flexes the hip and the knee, is important. And this will also connect down by the knee itself as well. And then this is, what was I going to say? I was going to say something. Okay. So these are some of the muscles for those inner muscles for adduction, right? Adduction going toward the midline. So those are those big ones that we just saw. And then, of course, your posterior thigh muscles, that's basically the back ones, the hamstrings, so to speak. These are for flexion and rotation of the knee. So to basically bend your knee, that is your hamstrings. Okay. So ultimately then, when you take a look at your quad group, right, this is flexion of the hip or extension of the knee. That's also the quad, right? We have weight reps that basically do that. Basically, you're kind of extending out your knee and that flexes your quads, but also your quads are important in also the flexion of your knee. So you have the quadriceps, basically the quad group that does this. And so you have a couple of different members of that quad group. And then you also have the sartorius involved in that as well, the flexion of the hip and the extension of the knee. So those are both of those individuals. And then to adduct the thigh, you have your adductor group, which is the one we just talked about, that big inner adductor group, and the gracilis and the pectineus. So these are those sort of medial side of the thigh muscles, those adductors, that gives you a lot of powerful adduction and keeps your leg kind of close to the midline. And then in the posterior, basically, is mostly the hamstrings. So when you take a look at these guys, you see your gluteus maximus. Then you see on the medial side is going to be your biceps femoris. And then on the lateral side will be your semitendinosus. And typically underneath that will be your semimembranosus, which is this little piece right here that kind of moves right underneath the semitendinosus. This thin strip on the side over here, that's going to be your gracilis, because that's the medial side of the leg. And then you can see the fan-like adductor magnus on the inside as well. So you have the biceps femoris on your lateral side, and that's going to be a big major flexor. of the knee and the semitendinosus on the medial side, along with semimembranosus, which is underneath that. Now, in our cats, we didn't really see the two differences between semitendinosus and membranosus, because tendinosis and membranosus tends to get stuck together. I mean, those cats, but we can see the difference between those two in our models. Now, when we flip it over to the quad group, this is kind of what it looks like, right? So this is basically going to be extensors of the knee. So here you can see the sartorius, which basically wraps over the quad group here. And so it connects to the knee, that is the medial side of the knee. And so on the quad group, you can see a vastus medialis on the inside, vastus lateralis on the outside, and then you have rectus femoris right down the middle. And then if you look at the cutaway, you can see on the medial side, gracilis, which is your groin, basically. And then you can see adductor longus and pectineus. And then you can see the iliopsoas group, right? The iliacus and major pieces. Underneath, sometimes you can also see on the models, you can see the adductor magnus. Sometimes it's kind of a big fan shape, but you got to sort of rotate it around medially in order to see it. So that's your quad group. And so we're going to put a good star next to this one. Now, ankle foot, don't want to do too much of a focus on this one. But basically, you have three leg compartments: anterior, lateral, and posterior. So the anterior compartment, which is the one kind of facing out, these are extensors. They're associated with dorsiflexion and eversion, inversion of the foot, right? So basically, extension of the toes, dorsiflexion is where you extend the toe. Lateral compartment is essentially plantar flexion or eversion. And the posterior compartment, which is the compartment that's just behind, is associated with plantar flexion. They have a common tendon, and they all kind of come together in the calcaneal tendon. That's your Achilles tendon. And so this is where you find your gastrocnemius, your plantaris, your soleus, things like that. And the deep muscles are plantar flexors and flexors. So if you take a look at a cross section, it's kind of helpful sometimes to see these differences. Here you can see on this side the lateral. This is the lateral side. This is your anterior side. So this is your tibia, right? That's your shin bone. Just to kind of show you, this is the front, if you will, of your leg. This is kind of the back of your leg. That's your posterior, right? So when you take a look at this, you can actually see some of the compartments. So here is your anterior compartment here, where you basically are doing most of your dorsiflexion and inversion, eversion, extension of the toes. And this is your posterior compartment back here. So it's a big, big compartment. There's a lot going on there. But you have a couple of different pieces. You have a deep and a superficial compartment. So the superficial will flex the knee. So that's this piece here, which is this blue part. So they kind of put it in purple. So this purple part right here is your superficial posterior compartment. And then you have your deeper, which is in green. This is going to be the one that's responsible for knee flexion, plantar flexion, and inversion, eversion. And of course, your lateral compartment, don't forget about this one. It's a small compartment, but it's out here in this kind of light blue color. So this kind of shows you the compartments that are there, just to give you a little bit of orientation of how the muscle is laid out. So when you take a look at the posterior view, first of all, you can see a couple of things. The gastrocnemius, right? You can see both the medial and the lateral head of the gastrocnemius. Underneath that, a lot of times you can see this little bit of muscle peeking out from underneath. That's the plantaris. If you take away the gastrocnemius, you can see the plantaris is this kind of long, thin muscle that comes in and attaches to the backside of the medial or the lateral condyle of the femur. And then a sheet of muscle underneath it, which is a soleus, thin sheet, is just underneath the gastrocnemius. So here's the cutaway of the gastrocnemius, the tendon that's left associated with that. So just underneath the gastrocnemius, you're going to see the soleus. Now, when you take a look then at the deep, so if you go deep, so you can see you're going from superficial You cut away a piece. If you cut away the soleus, then you're going to be taking a look at some deeper muscles. For instance, you're going to see tibialis posterior, which is basically attached to the backside of the tibia. You're going to see the flexor digitorum longus, which is a flexor that's on the calf side. So this is all underneath the gastrocnemius. And you're going to see flexor hallucis longus, which is a feather-like muscle that basically is attached to the big toe. So hallucis is the big toe. And then you're going to see the fibularis longus and brevis, which is this little group right here. There's two of them, a short muscle and a long muscle. And then if you basically take off those, you can see and isolate tibialis posterior and flexor longus. So you can see that this is kind of a nice one because what they're doing is they're basically taking off one layer at a time. So you can see the individual muscles kind of layer by layer by layer. So I'm going to put a star next to that one. We have kind of a similar situation, and now we're going to taking a lateral, a medial, and an anterior view. So the lateral view basically is going to be looking at the outside of your foot. So here you can first of all see our landmark. That's tibialis anterior. That's that big one that kind of is right next to your shin bone. That is the tibia. So that's your tibialis anterior. As you start to rotate laterally, you're going to run into extensor digitorum longus, which is basically going to extend and have a bunch of tendons going to your toes. So it extends your digits, your toe digits. And then as you rotate from in there, you're going to basically run into your fibularis group or your peroneus group. You're going to run into longus and brevis. So brevis is the shorter version. Longus is the longer version. You also have tertius, which is underneath the foot. So that typically is, do they have it? They don't have it labeled. They show up, but they don't have a label. So that's kind of what we saw with the model. So we kind of did a rundown on this one as well. And then below that, you're going to see the soleus, and then you're going to see the gastrocnemius. And so that's kind of rotating laterally around the leg. Now to do the same thing kind of medially around the leg, you're going to have your tibialis anterior here, and you're going to run into the tibia. And then as you start to rotate over, you should see the soleus on the on this medial side and the gastrocnemius on this medial side. But you should see peeking out underneath, you should see the tibialis posterior, or that's a deeper muscle that we had to cut away for. That's mostly what you're going to see. If you take a look at it head on, you'll see here's your tibia, and then the muscle right next to the tibia is going to be your tibialis anterior. And then typically right next to that one, which is this guy right here, is going to be your extensor digitorum longus. And then as you move next to that, you're going to see your fibularis group. This is your fibularis longus, and then brevis is underneath. And then as you rotate to the medial side of your anterior view, you're going to see basically the flexor longus, and probably your soleus and your gastrocnemius on the other. So this is also a good one that bears and should get a star. So this is basically the table for those muscle groups. So the leg is going to be important. We're going to put that on our list of things that we want to know. And extensors and flexors of the lower leg. So these will all help dovetail together to basically help us in our studies for the exam itself. And when we take a look at the foot, similar to the hand, you can see you've got a bunch of flexors associated with it. You have similar sorts of things. Basically, between the foot, you have the lumbricals, which will basically kind of move into the tendons associated with moving the digits itself. And then you have your flexor digitorum brevis, which is a flexor of the digits. So basically, this is kind of helping you flex your digits. You have an adductor hallucis, which is an adductor of the big toe. So you adduct it, you move it toward the median. And then your adductor digiti minimi, which is basically moving your little toe. So that's going to be an adductor for that one. Remember, adductors means you're moving it toward the midline of the body. And then you have your flexors, right? So you have your flexors for the hallucis brevis. So you're going to be flexing it. So that's curling your big toe under. and you're going to flexor digiti minimi brevis, which is flexing your little pinky toe, curling it under. Okay. And so here they've cut away a couple of muscles. So in this case, your flexor digitorum brevis has been cut away. So that's this piece right here. Your plantar fascia, your plantar epineuroses, which is this piece right here, kind of wraps around the bottom of your foot, creating the sole of your foot. That's been cut away. And so now what you're seeing is a clearer picture of your flexor hallucis brevis, where those are the two flexor muscles that are basically curling your big toe under. You can see how they're on the underside of the big toe, curling it under. And then you can see your flexor digitorum longus tendons. So these are the tendons of your flexor digitorum longus, if you recall, is up in your lower leg. So what you have basically some tendons and some muscles. I keep saying muscles. Some muscles that basically wrap around. So you can see how some of these, let me see, where's my flexor, it's extensor. I'll go with this one. So basically, when you take a look at your flexor, basically the tendons will come down and they wrap around the bottom side of the foot. The tendons do, and then they make their connection underneath the foot. And that's kind of what you're seeing. The extensors kind of do the same thing. They basically go along the top side of your foot and they connect to the top side of the toes. That's the reason why you kind of see these like little ridges, tendons connecting all your lower leg muscles, your extensors, to the tops of your feet. And also the reason why you kind of feel these rope-like ligaments or tendons inside the bottom of your foot, the sole of your foot. So that's basically going to be associated with a lot of these tendons associated with your flexor digitorum longus, which you can see breaks up and connects to each one of your minor digits. So that gives you the ability to curl your toes, your smaller toes. So we won't worry so much about the foot muscles, just like we didn't worry so much about the hand muscles. But basically, that essentially runs us down on everything chapter 10. Okay, any questions? I'll tell you what I'm not going to do. Even though we've got like 9 minutes left. I'm not going to start chapter 11. So what I'm going to do, since the next time we meet, it's going to be exam day. So we'll have the lecture exam and the lab exam, similar to what we did last time. This is going to be a bit of a harder setup for us, so be patient. Because the setup for the lab exam may kind of go into our normal scheduled time, so just be patient. We will be probably in there setting things up, but we'll do the same thing we did last time. I'm going to arrange it and time it a little bit differently because it's not quite as clean and neat. So I'll let you know how that kind of gets organized and set up when we get ready to set up the exam. But instead of starting 11, I'll just leave it at that. What I'm also going to do is I'm going to set up another chapter, like a chapter 10 connect assignment, so that you guys can kind of go through and work on some of this. So basically spending the next 5 days just studying muscles. And then after we take the test on muscles, we'll start next Thursday with the beginning of chapter 11. Does that sound okay?
So the lecture exam is going to cover 9, 10, or 8, 9, and 10.
Correct.
Okay.
8, 9, and 10. And I mean, it's going to be a little picky and choosy in 10, right? Because I mean, there's a lot of things that aren't an emphasis, but I tried to put stars on some of the things that are big. And then, of course, a lot of the mechanical stuff, like, the lever system of muscles, the nomenclature of muscles, the basic mechanics of muscles, and things like that. So a lot of that'll be there. In
Okay.
terms, it's the gross anatomy stuff that will be kind of deprioritized. Like, for instance, I don't feel comfortable if people are not doing well in the exam because they're not masters of all the little itty bitty muscles in the pelvic floor, right? That's an example. Okay. Any other questions?